I'm Giovanni Dennis with the Midday News. A special welcome if you're joining us online at onespotmedia.com. The World Health Organization says it is actively tracking new COVID-19 variants. This is out of concerns raised that some of the vaccines developed may not provide good coverage against these variants. Shamila Pullen reports.
The World Health Organization, WHO, says in the last few months it has seen an emergence of COVID-19 variants. The WHO says while it is not totally unexpected, some of the variants are of concern.
As you know, WHO has a nomenclature now of how to define these variants of interest, and then variants of concern are those that are based on changes in transmission capacity, changes in the clinical features, or changes in their way they respond to drugs or vaccines.
It also observed that some of the vaccines developed for COVID-19 have a lower efficacy against the new variants. This is particularly in Africa, where the B.1.3.1 variant was discovered.
Scientists and companies have already started thinking about the next version of the vaccine that might incorporate those mutations. And luckily, some of these platforms that are being used now, the mRNA platform and the viral vectored platforms, allow very rapid changes in the vaccine composition. And so we are working with a number of scientific expert groups around the world, as well as with the regulatory agencies, to both study the science as it is changing and evolving.
However, more information is needed. It is calling on countries to collect data and document the effectiveness of these vaccines to help the WHO make decisions.
We still need to see whether the existing vaccines are able to prevent severe disease and death, even amongst people infected with the variants. And it is possible that that could be the case. And there are many vaccines in clinical development still using a whole host of different platforms. Some of those vaccines may be more effective. The inactivated vaccines, which use the whole virus, for example, which have all the proteins of the virus, potentially are they more effective against the variant?
Shamila Pullen, TVJ News.
The Medical Association of Jamaica has joined the Medical Students Association in calling for medical students to be vaccinated this week. Both entities argue that as the number of COVID-19 patients increase, medical students will be asked to assist even further.
In the past, final year medical students have actually been called upon in times of challenges to actually act as interns. There's precedent for that. I am sure that in the coming weeks to months, we're going to have to call on volunteers from the Medical Students Association to help with what is happening. We need all hands on deck. And that's from the point of view of service delivery. They are part of the healthcare team. Also, from the point of view of their clinical training, they would have lost most of a year of clinical exposure, and that's critical in their development. So we need to have them vaccinated from the point of view of both service delivery and from the point of view of their training. It is critical.
2 more persons have died from COVID-19 in Jamaica. The number of COVID-19 deaths is now 494. The latest cases include an 86-year-old female from Kingston and St. Andrew and an 82-year-old male from St. Mary. Meanwhile, Jamaica also recorded 602 new COVID-19 cases on Monday. This pushes the number of confirmed cases to 31,907. Kingston and St. Andrew recorded the most with 146, followed by St. Catherine with 104. Meanwhile, 354 persons remain in hospital. 27 are critically ill. There are currently 15,807 active COVID-19 cases. Over 110 police were vaccinated at the Port Antonio Police Station in Portland yesterday. The vaccination is part of the Health Ministry's initiative to protect all frontline workers against the virus. Public health nurse for the parish, Marian Green Williams, says responses have been good since the rollout of the vaccine.
Take has been good. For the first day we had 10, first day we had 30, And then for the second day, we had about another 40 or 60 thereabout. I'm not sure, but the numbers are at the health department. But the uptake has been good. Persons have been asking, but we have been focusing on the healthcare workers thus far. And hence today we're here with our security forces. Later this afternoon, we will continue with our healthcare workers at the Port Antonio Hospital.
Now, those workers will be required to get their second jab on May 17. Inspector of Police for Portland, Maurice McLean, gave his take on the vaccinations.
It's a wonderful thing. I mean, if the authorities say it's the best thing to treat it as it relates to getting rid of the COVID and minimizing the spread, why not? I'm all for it.
The Manchester police are reporting a reduction in major crimes in the parish since the start of the year. There were 52 incidents compared to 70 during the same period in 2020. Deputy Superintendent in charge of operations for Manchester, Lloyd Darby, says a number of the crimes has been solved.
10 or 19% of these reports have been cleared. Additionally, 13 were cleared for the previous years, which brings an overall clear up of 44%. The category 1 crime of murder, 5 murders have been reported for this period compared to 8 for the corresponding period, a decrease of 38%. Shootings, 4 have been reported compared to 5 for the corresponding period. This is a decrease of only 1 or 20%.
DSP Darby, who was addressing the Manchester Municipal Corporation's monthly meeting last week, also said at least 20% of shootings has been cleared. However, rapes and robberies continue to be a concern for the police.
Because we have had 16 robberies reported compared to 15 for 2020. And this is the only category that is showing an increase, that increase of 1. And as I said, it's a particular concern to us, because we see the trend of daylight robberies occurring in the Asia police area, in the Christiana police area, and the last one on Tuesday in the Christiana police area resulted in a murder.
The St. Elizabeth police are appealing to motorcyclists to stop disobeying the road code. The appeal comes following 2 separate motorcycle collisions in the parish on Monday. Sandy Williams reports.
About 3 o'clock yesterday afternoon, the Whitehall Main Road in St. Elizabeth was the scene of a motorcycle collision. According to police reports, a biker was traveling from the Middlesex direction. Upon reaching a section of the Whitehall Main Road, a Toyota Corolla drove out in the path of the motorbike.
The driver of the Toyota Corolla drove from a shop into the path of the motorcycle, causing collision. The motorcyclist was rushed to the Black River Hospital, where he is presently undergoing treatment.
20 minutes later, another motorcycle crash, this time on the Luana Main Road in Black River. It's understood that a motorcyclist was driving from Black River towards Luana when he lost control of the vehicle and collided with a Toyota Noah that was traveling in the opposite direction.
Driver of the motorcycle lost control, ended up on the right-hand side of the road and collided with the Toyota Noah. He has been rushed to the Black River Hospital, where he is presently undergoing treatment.
These latest incidents have raised concern about the lack of regards given to the road code by motorcyclists. The police say in both incidents, the motorcyclists were not wearing helmets.
The motorcyclists in St. Elizabeth, they are a major problem. We have held a number of meetings with these motorcyclists, and apparently they are not taking heed.
Also, one of the bikes did not have a license plate, a practice the police say is becoming more prevalent.
Right, that is also one of our major concerns. Our motorcyclists will just go into a shop and buy a motorcycle and refuse to comply with the law. So therefore, this one is a prime example. No plate affixed to the motorcycle.
The police are appealing to motorcyclists to obey the road code.
I want to warn all motorcyclists to be extremely careful on the road, especially this road that has been recently rehabilitated. And I realized that all these cyclists, they are not wearing helmet. So I'm asking you to just protect yourself and obey the road code.
Sandy Williams, TVJ News.
And it's now time for a break here on the Midday News, but please stay with us. We'll have much more when you return. Welcome back, and we're continuing the news. Farmers in Winchester St. Thomas are furious with what they consider a lack of transparency from the Sugar Company of Jamaica SCJ. The farmers say while other persons occupying lands were given the go-ahead to lease and farm, they are being told to leave. Javon Keys has this follow-up.
Frustration from farmers in Winchester St. Thomas. Many were a part of the fight for land in the neighboring Wheelers Field, but now an unexpected twist. They tell us they're being asked to leave.
Golden Grove get through. We and Golden Grove was on one thing. I fight the media from Willowfield to Golden Grove. And imagine Willowfield, half of Willowfield get through. Golden Grove get through. Why Winchester can't get through? We're not leaving.
The farmers, mostly former sugar workers, say they've been on the land for almost 2 years and they were told by the Sugar Company of Jamaica SCJ to keep farming.
We have been promised lease agreement and we are now being told that the lands that we are occupying are not owned by SCJ and that they cannot accommodate us.
The land they currently occupy is highlighted in blue. The SCJ did indicate it leased the plot from the Jamaica Producers Group for about 25 years. The SCJ has since put these lands up for subleasing to medium-sized farmers who are also involved in agro-processing. They are currently awaiting proposals, but these farmers say they feel excluded from the new arrangements.
It's pure hearsay. Nobody is coming to us directly to meet with us and discuss the matters at hand. The farmers, they have invested their little monies, what they got from their redundancy with the Sugar Corporation, all of that they have invested back into farming. And right now, the farmers, they are worried.
We not take it easy. We are stand up. If I have the bulldozer, when I come, me a lie down. Cause me a whole woman, the little money won't give me. I eat me take plow over there, so.
The SCJ spoke about the farmers settled on the land at last week's press briefing.
We are pleading today for their cooperation in supporting us as we seek to resettle them in the areas that have been set aside for smaller farmers.
Javon Keys, TVJ News.
More concerns this afternoon about operational changes by the Jamaica Public Service. The utility company has been heavily criticized by councillors at the Clarendon Municipal Corporation. This following the closure of the JPS office in Maypen. Councillor for the Denby Division, Joel Williams, was particularly strident on the matter. He said it was unreasonable to ask people to do more transactions online, considering all the challenges with access to internet, technological devices, and technological know-how among some age groups. He demanded that JPS reconsider the decision.
If we're having the challenges that we are facing today, insofar as our schoolers are concerned, the youngsters online, to navigate the various issues as it relates to their education. You can imagine what it is going to be for the senior citizens, the elders, those who are not as savvy as some of us are. The challenge, I think this is just wrong, madam. The timing is incorrect, and I'm asking at the highest level that JPS revisit this matter.
The JPS closed 7 of its locations island-wide. The closures took effect early this month. According to the JPS, the decision was taken because more people are opting to pay their bills online as opposed to visiting the branches physically. Councillors in Manchester and St. Thomas have also criticized the changes by the JPS. The Consumer Price Index dipped in February as the price of vegetables fell enough to outweigh an increase in electricity rates and petrol prices. Statin on Monday reported that the outcome was an inflation rate of 0.1% during the month. Statin says the new tariff rate changes for JPS approved by the Office of Utilities Regulation resulted in the increase in electricity. The point-to-point inflation rate is now 3.8%, which is notably below the Bank of Jamaica's 4 to 6% target. There's a desperate plea this afternoon from residents of Buff Bay, Portland, for the authorities to replace a bridge that has been out of use for more than 3 years. There's also heightened concerns that what is left of the bridge might soon collapse. Cody and Barrett reports.
The Craig Mill Bridge in Buff Bay, Portland is gradually developing into a death trap. Residents say the infrastructure connecting several other communities is deteriorating fast. 3 years ago, the bridge was ordered closed by the National Works Agency and a new route was created. But residents say in cases of an emergency, they are left with no choice than to use the bridge, thereby risking their lives.
I'm a sickly woman and I have underlying sickness. And if I should take sick in the night and the river come down and the bridge gone, what happened? We're just dead. We need the bridge to be fixed. And we want the relative Vanta Authority to come now and do something about the bridge. Too much running around with this bridge.
Purpose not going on the bridge neither. We take chance because we live here, we don't have a choice. Because the water in there now is swift. Me afraid of water, so me not going to swift water across it. Even though me born and go with the river down there, me not going in there. I will set me dress and going out. Oh no, I won't go in there. So we have to use it. And that's not safe for us. You guys see it.
So we are in a desperate situation. So we are asking the authority who is in charge of this bridge to do something for us now. It's full time.
Some residents also complain that the falling infrastructure has negatively impacted their livelihoods. It's the reason they are appealing to the relevant authority to intervene.
Right now, so I have my trowel, I do me work, I do carpenter work, I can't get no material, I forget some black from the other day and I can't get them. Cement are the said problem.
Can't even plant. It hamper the whole process of production. Why you produce and you can't get it out of the community. We can't even get it out of the community and discuss disunity.
Cody and Barrett, TVJ News.
To news overseas, overwhelmed hospitals and vaccine shortages are exacerbating the COVID-19 crisis in Brazil. More from the CNN.
Pamela Ravipi can only look at the photos of her grandmother. She says watching the videos is too painful. The world didn't deserve my grandma, she says. She was too good. Admitted March 3rd with COVID at this small hospital outside Sao Paulo, she died just 2 days later. The facility quickly overrun by a new wave of COVID-19.
A gente pensa naquela família que tá sofrendo.
This doctor who works there says we think about the families that are suffering and we can't sleep. It is unbelievable.
This hospital just doesn't have the facilities to care for those who are really sick. Those patients would usually get transferred somewhere else, but right now there's nowhere else to go. So instead of getting transferred, they're dying.
In just 5 days last week, 12 patients died waiting for an open bed somewhere else, according to hospital officials. Pamela's grandmother was one of them. She thinks that she would have survived if treated in an ICU. But right now, access to those facilities is nearly impossible. Albert Einstein Hospital is one of Brazil's best, but here too, the rooms are full. They are scrambling to build more ICU beds because the patients just keep coming.
It's the most busy time we have ever been in this last year.
We first saw hints of this about 6 weeks ago when we reported from Manaus, a city in Brazil's Amazon rainforest. Hospitals there were overwhelmed amidst a new outbreak, and the city was forced to build so-called vertical graves. And from then to now, that chaos has spread nationwide. In 22 of 26 Brazilian states, ICU capacity is at or above 80%, government data shows. In Sao Paulo, it's 90% and climbing. And when you run out of beds, doctors tell us, people die.
To news and sports, our newsroom has learned that one of the players called up for a training camp ahead of the friendly international between the United States and the Reggae Boys has tested positive for COVID-19. This as hopes that a new contract between the team and the JFF would have been in place by now appear to have been dashed. Karen Madden reports.
TVJ Sports has learned that several of the existing senior players have not signed the latest contract offer. When the players revised their contract last week and the JFF agreed on most of their terms, it had been hoped that the parties would be of one accord. But with the JFF sticking to its original match fee, the players have reportedly dug in their heels. However, a JFF source told TVJ Sports that this latest development will not impact the friendly international between Jamaica and the United States on March 25, as the contract is scheduled to come into effect on April 1. It's understood that the Federation believes it has enough players who are willing to travel to Austria for that friendly. It's also understood that players who have agreed to the terms of the agreement for the US game did their COVID-19 test on Monday, with one of the 14 players testing positive and was sent home to be isolated. The other 13 are now in camp and will begin training soon. The JFF was given the go-ahead to host a training camp with full COVID-19 protocols ahead of the team's departure. It's however not clear how this latest development will impact the ongoing contract negotiations for the 2-year period, which includes the CONCACAF Gold Cup and the World Cup qualification tournaments. TVJ Sports further understands that the JFF has managed to secure signatures from other players. The negotiations with the JFF was being led by attorney Robert Taylor. Efforts to contact him by telephone on Monday were unsuccessful, as we were told he was not in office. Karen Madden, TVJ Sports.
And that's the Midday News. I'm Giovanni Dennis. Join us at 7 for Primetime News. On behalf of the news, sports and production teams, have a good afternoon.